I love urology. And the reason why I love urology, because it's just all encompassing. So for me, I like surgery. I like the urinary tract. It's a system that I think that I can really understand and I can get to know it. And so this was a challenge to me. It wasn't all about necessarily doing the cystoscopy and putting that instrument through the genital organ, the urethra, the male or the female urethra, but was actually seeing inside the body, being able to see the blood vessels inside the bladder, inside. You could see sometimes pathology just looking at the vessels. Special to me, when I show the students, I say, look here through the cystoscope. You can see the blood vessel, and you can actually see the red blood cells traveling through the blood vessel if you look very closely during cystoscopy. And one thing I can say about urology is that we're able to make a diagnosis for our patient. We're able to use other areas, such as radiology, to concur with our diagnoses, and then we're able to treat them. And even after we treat them, either if it's surgery or medication, we're able to follow those patients long into their lifespan and see them through their course of their disease. So that is, to me, is very interesting about urology, and one of the reasons why I went into urology. I've known my patients for several decades, and I've grown older with my patients through several decades and been able to even see their children. And so that's important for me in terms of being a urologist, that I really especially like about this field. And it's very special. It's a very special bond that you can develop with your patient.
I guess I had some sort of epiphany back when I was going through my early years of training. I knew that surgery suited who I was. When we know back in medical school what kind of temperament individuals have. And I could tell you back in almost my first year of medical school who's going to be the psychiatrist, who's going to be the surgeon. If you're squeamish about doing your cadaveric dissections, you shouldn't be a surgeon. But I knew I was going to be a physician back in my believe it or not, probably my teenage years. I just had a sense that this was the right thing for me to do. Certainly, we recognize things like caring for patients and caring for people and seeing what physicians do and do. I think I have a talent for science and medicine and things of that sort. And I think that was true. That rang true for me. And I had a sense, even in those years, that was the career I wanted to do. I wasn't going to be a journalist. I wasn't going to be a lawyer like my dad. That just didn't appeal to me. But to me, being a physician is a noble profession where you can have impact on people's lives. And I could see that, even at that age. But, within surgery now, urology is a subspecialty. And early on, I kind of said, well, maybe I'd be a general surgeon. But, I realized also within urology that it had some appeal for a couple of reasons. One reason is that I recognized the role of a black urologist early on, particularly with regard to some of the disease states that occur in the black community. And I already spoke to one of these, prostate cancer. And so I've really held true to that kind of purpose for 35 years of my career now, 30-something years of my career, to be an advocate surrounding the care of black men with prostate cancer. As I mentioned, prostate cancer occurs about 60% greater incidence in men who are black. About 1 in 9 men in the general community have prostate cancer. 1 in 6 black men get prostate cancer. Those are serious numbers in the whole community, but also in the black community. And we know the mortality rate is 2.5-fold higher among black men who get prostate cancer. So having a real purpose there was something that I recognized even in medical school, and said urology makes sense for me because I think I can have some impact in that, and I think I have. And so that perhaps is one of the biggest factors. As a surgeon in urology, you have the entire patient in your hand. You can work the patient up, you can do these procedures, you can follow them up. Some other surgery specialties, like the cardiac surgeon, you got to wait on the cardiologist to get you a patient. So urology, you really have control of the patient, or the condition of the patient, the evaluation and the management. And I like that. And I liked also urology did have some specialty areas. Sexual medicine, reconstructive urology that I do, where it's not emergent care. So you can do surgery without feeling you got to run around all day and all night. So there's some of these other secondary factors played a role as well.
I think when I was at Georgetown, as a medical student, I was interested in nephrology. And I remember being interested in it because the professor speaks to how professors can have a lasting impact, who gave a lecture on the kidney was just utterly fascinating to me. So I thought, well, gee, I want to be a nephrologist. And then when we got to the wards, I thought, well, I want to be a surgeon. I really don't want to be a nephrologist. It's close, but urology is what I want to be. And at the end of my 6 weeks or so with Dr. Bassett, I determined I wanted to be a urologist. Now, nobody told me, maybe because I never asked, that there were virtually no female urologists. I thought, this is what I want to be. He never said you can't. And so I did. Eye on the prize. Yeah. What do I want to do? I want to be a urologist. How do I get there? There it is. That's what I like about medicine. Actually, one of the things I like about medicine and urology. If you want to get to point Z, there's a roadmap. You just have to, go for it. Don't let anything push you off the track. Just stay on your track. Keep your focus. Do what it is you want to do. You can do it. And I'm so excited that now that we have so many more African Americans or other minorities and women in the field of urology, it's fun. It's exciting. Many years ago, one of my colleagues at our grand rounds here at UCLA showed a picture of his, he was chairman at a program out east in the South, and he showed a picture of his residents. And it was shocking to me, because every last resident, was a white male. And I don't think you really see that anymore. You see most programs have at least, have women, have minorities, have a composite. It doesn't do the program justice, I feel, just to have one ethnicity, one sex, not in a healthy, thriving, growing program.
My story is a little unique in that it's been my dream to become a doctor since I was 5 years old. And the inspiration for that was my younger brother, who had seizures growing up. And so seeing him being treated by doctors and how they would help my brother was what inspired me to go into medicine. So I had that desire from a really young age, and I've been able to kind of maintain it. And obviously my family, my friends, and teachers supported and nurtured that dream. I didn't really know what the realities of medicine was and how to navigate it and how long of a journey and how expensive and challenging it can be overall.
I come from a really large family of people that are in healthcare. I have aunts that are nurses. My mom is a nurse. I have cousins that are doctors. And so I really got to see that growing up around me. It was really important that my father had my siblings and I see Black providers, and not just Black providers, but my father really emphasized me seeing Black female providers. So my dermatologist, my PCP, my OB-GYN, just very grateful for that exposure that I got at such a young age. Things that not everyone gets to witness or see. Mom would come home from 12-hour shifts and tell me about some of the experiences she had with her patients. And I remember just being so in awe of the fact that she could form these type of connections with people that maybe she had just met, or people she had known for maybe a month or so, because they've still been on a unit and their problems were still being managed. And so I really was starting to aspire toward that, to have something of that sort of connection with a person in my career as well. And I think that's the power of medicine.
At Wayne State University, I was able to matriculate into a BS/MD program. So I was accepted into med school right out of high school to both Wayne State's college and their medical school. And I decided to pursue urology, I think my senior year of high school, after seeing numerous health disparities in my family and actually being exposed to urology as a profession. And during my time in college, I've done research here at Henry Ford Hospital in urology. I worked in various urology practices, and yeah, I hope to be a leader in the field one day as a urologic surgeon scientist. The first cases I observed in urology were stone cases. They were a ureteroscopy and a PNCL. And I was in the OR with the anesthesiologist because I wasn't able to be in the sterile field, but I was just so fascinated by the lasers and the ability to perform surgery without any incisions. It was so cosmetically appealing to not only the patient when I learned afterwards, but also to the surgeon who's like, I was able to do an incomparable good in their quality of life without having to do any incisions anywhere on their body. And I thought I wanted to do that one day, to serve people like that.